Good morning, students. Welcome back to the module Nutrition, Biochemistry, and Exercise for Health. And I hope you all have done and passed the component one, that is the assignment one of this module, that was based on specific questions. And now, from today, we are going to start to discuss the topics that are related to the component 2 of this module. And today, we are discussing on cardiovascular diseases, particularly hypertension. So what the today objectives are? Today objectives are that at the end of the session, you should able to understand and explain the role and the risk of the factors that actually causes the cardiovascular diseases. That means the cardiac related, heart related ailments, problems and illnesses. Then second objective is to understand the role of nutritional and physical activity. Why? To treat, that is the management, and to prevent the cardiac disorders, particularly hypertension. Before going to discuss directly about the cardiac diseases and the hypertension, the basic concept we should know that what actually the heart is. And to this we say as the anatomy. What's mean by the anatomy is, anatomy means that to study the identification and description of the structures of living beings, such as the different parts or the organs of a human body, where we are going to discuss about the heart, because we are going to discuss about the heart diseases. So what actually the anatomy of heart is? Heart is in conical shape, and from outside, if we see, it composed of a layer. But when we go in detail and microscopically as well, and by dissecting it longitudinally, it actually composed of three layers, named as outer epicardium. Then middle is myocardium. Why when we are saying it myocardium? Because it's composed of some specific muscle cells. It composed of the muscles. So myo means muscles, epi means outer. And then third, the inner one, the most inner one. It is called as endocardium. Endo means inner. Cardium means cardiac layer. So what is then pericardium is? Pericardium is actually a fluid that is present between the outer layer, that is epicardium, and myocardium in a sac called as the pericardium or pericardial cavity. And this fluid is called as pericardial fluid. And how we can relate it with the example, for example, of a wall. In UK, the wall is not a simple structure of the bricks of a well-structured house. There is an outer layer of red bricks, then inner side of the cavity, and further inner side, then there is a cardboard or a block form that is the inside wall layer have. So in this way, there is also anatomy of a heart according to its function that God has created for every human being. Furthermore, a heart is also composed of four chambers that are called as the right and left ventricle and right and left atrium. That means one singular is called as the atrium. And what other structures of the heart have that also plays vital functions? Okay. So first is the pulmonary artery. Then second is the aorta. Then third is the pulmonary vein. Then superior and inferior vena cava. And then pulmonary veins. So what are actually the functions of these veins and arteries are? That pulmonary artery means that it's push the blood, it carries the blood from the heart, that is the oxygenated blood, clean blood, from the heart to the lungs. But here is the opposite. Actually, in normal way, arteries all carry the oxygenated blood. But for the heart, it is opposite. It is actually not the oxygenated blood. The blood which is deoxygenated, blood is all collected into the right ventricle of the heart. through the vena cava, superior vena cava from our body into the right atrium, then right ventricle. And then this deoxygenated blood carries to the lungs through this pulmonary vein. Then what happened when this blood go to the exposed to the lungs, then it becomes the oxygenated blood. Then this oxygenated blood come into the left atrium to the pulmonary vein and then to the left ventricle from where the heart contracts and then push the blood, that is the clean oxygenated blood, from the aorta to all our body parts to survive, to live for nutrition and oxygen. So, like the same way, heart also requires the oxygenated blood to function, to survive, to live. So the names of these arteries are left anterior descending coronary artery, circumflex. This is the circumflex artery, which means it's surrounding the heart, around the circumference of the heart in the cross-section way. And then left main coronary artery, it is here. Now, myocardial oxygen utilization. What is actually this? That's the same way as our body requires oxygen to survive and function. Here is example of the muscles which requires and use oxygen for functioning, surviving, and working. It's 25%. But as oxygen works continuously without stopping 24/7 hours without any resting, so because of this and continuously work, it needs more oxygen than other parts of the body, and that is 70 to 80% of oxygen compared to muscles. There are some conditions as well when our heart works more vigorously, more faster. Why? Because to supply the blood and oxygen then at higher level than comparative to and at normal position. And the example of that situation is like exercise or running fast or for long. And how then this function process by means of the coronary arteries, they become dilated in this way. For example, this is the normal way, like a pipe, the normal opening of the arteries of the heart. But during the exercise, the circumference, the diameter of the cardiac arteries, coronary arteries relaxes, dilated to supply more blood to the heart to function appropriately. And secondly, also the volume of the blood increased by increasing the aortic pressure to provide the good coronary circulation. So this picture is giving you the example how the blood flow is regulated by narrowing the lumen and dilating the lumen of an artery. There are various cardiac diseases such as coronary heart disease, stroke, peripheral vascular heart disease, congenital heart disease, valvular heart disease, heart failure, and hypertension. So what is mean by the coronary heart disease? That means the disease, the problem is actually arised in the coronary arteries that results into the cardiac problems, maybe the narrowing of the coronary arteries, that's why. Then the stroke, cardiac ischemia, that means that stopping or inhibiting or obstruction or the occlusion of artery that supplies the blood to the heart, thus results in the ischemia that may be with the fatal towards the death or the heart attack. That is called as then heart failure. And what is the hypertension? Hyper means increase. It means the high blood pressure. Where the congenital heart disease means by birth, the infant born with any cardiac malfunctioning or a problem. So here are some explanation of the related diseases that are related to the heart problems. So now we're discussing in detail about the hypertension. Hypertension means what? That high blood pressure, and how it can be translated? Hyper. Hyper means increase, elevation, and where the tension word means the pressure. So in this, if we translate it into the further simplified form, it means that increase the rise of the pressure, but of what? Of blood. of blood in a human vessel, either an artery or a vein. So this is called as hypertension in clinical terms, while in normal terms it is called as high blood pressure. So high blood pressure causes the heart to work more harder. Why? Because of the problem of the obstruction of the arterial any valve or the artery that places a greater stress on the arteries and the arteries to work more and harder. Sometimes it is stopped to work or a heart becomes then hypertrophic, increase in size to manage its function. And this hypertension, if not treated or managed or prevented, it can lead to further worsening of the cardiac ailments. It can lead to the myocardial infarction, stroke, or atherosclerosis, or the kidney failure. Here is the explanation how the vessels are being affected. The normal is called as the major cause. Normal cause is called as the atherosclerosis, which I will discuss it in another slide later on. So what happened in this case? The fat started to deposit along the walls of the vessels. When it deposited on along the walls of the vessels, what happened? The normal lumen of the artery becomes more narrow. So narrow day by day. In this way, normal blood flow becomes disrupted, and in this way, so the normal blood supply affected to various parts of the organs, and in however, it leads to then lead to the various problems of the organs like the kidney failure, itself to the heart or to the brain like the stroke. And what are the normal ranges of the blood pressure? That are the less than 130 to 85 millimeters of mercury. But the ideal is less than 120 by 80 millimeters of mercury. So what is mean by this? It means that here is instrument by which we measure the blood pressure of a person, and it have a meter, and by this we cover a cuff around the arm of a patient and then put the air pump by pressing it, and in this way we notice the sound of the systolic and diastolic, that means the heart contraction and relaxation sound, to measure the what is the blood pressure of that person is by hearing through the stethoscope. So this actually it means measure by the mercury. That's why we measure it by the unit that is called as the millimeter of the mercury. And when the blood pressure is more than 130 by 85 millimeters of mercury, then it will come as a hypertensive condition. Here are some interventions that have noticed by some research articles that are being discussed here. Number one is the nutritional intervention that some researchers used it to prevent and control the nutritional hypertension by means of nutrition. So what that found that effective treatment diet should include the high fiber diet, low fat diet, and low salt diet. They result in preventing and controlling the hypertensive symptoms. While some other researchers also noticed that calcium, magnesium, and potassium high intake and sodium low intake have also beneficial effects to control the hypertension among the hypertensive patients. Here is the example of the saturated fats that I discussed it here. Okay, so low fat diet means that we are taking the diet that is high in polyunsaturated fats. What is meant by this is that the fat is divided into two. It is available in nature in two forms, that is the saturated fat and unsaturated fat. Which one is the healthy? Unsaturated fat. And from where we can take it, the sources of good fat, that is the unsaturated fat, or we can say in clinical term HDL. So HDL is good source are vegetable oils like sunflower oil, olive oil, soybean oil. And how we can identify that it's a good oil? How? The way that they are in the form of the liquid and room temperature comparative to the bad saturated fat that are solid at room temperature. Okay. And that's why they are called as HDL, good fat. That means high density lipoprotein. Here is another example that I already discussed with you, the low salt diet. Why? The reason is that salt have the capability to retain more water with it. If we take high salt diet, so more water retention, more edema in our body will be, and more chances, more risk of hypertension. That's why it is advised to take low salt diet in our food to prevent cardiac problems. Here is the example. See this edema? This is all because of the salt retention. Salt retaining the blood, water here. Now, other source, another intervention is through the vegetarian diet. If someone is vegetarian, how? Yes, still the diet can be modified by means of what? By taking high fiber diet, fiber by means of like whole grains, polyunsaturated fats like avocado and olive oil, nuts like peanut, almond, then vegetable proteins. Vegetable proteins examples are the legumes, lentils, some pulses, beans, especially red beans, and good source of the potassium and magnesium as well. Examples the broccoli, banana, cashews. So these are the good examples and sources of preventable and good source of vegetarian diet by which hypertension can be managed and controlled and prevented. So now, can you tell me now that what is the role of high intake of potassium if we take in our normal diet, and what are the good sources? Yes, here is the example. Yeah, and what are the sources and what's actually the mechanism? So please, after this video, put in the comments so what mechanism you find out, what actually their role potassium plays to control hypertension. Now next is the efficacy of low fat diet and low saturates. So high percentage of the polyunsaturated fats, how it's happened, how it controls the hypertension, can decrease the chance of the hypertension because it contains the good cholesterol, that is the HDL, high density lipoprotein, and it have the capability to not become solidified in our blood vessel because they are liquid at room temperature. So they are beneficial, may lower the blood pressure, who are hypertensive. They are also metabolized to prostaglandin. Prostaglandins is what these actually are the hormone-like, lipids in our body that is produced, such as our steroids or we can say eicosanoids. These are for the protection, the scavengers where in our body injury or something is going on. So they provide the blood clotting. For example, at any place there is a bleeding or any injury is there or an ailment or infection is there. Then their role is as a vasodilator and enhance sodium and water excretion as well. And what are the good sources of polyunsaturated fats are like avocado, olives, fish, oils, nuts like peanut, almonds, then seeds like sunflower seeds. Now here is another review, the link I am sharing with you. So please, after the session, click this link and read this whole research. In this research, the researcher did a review from many research articles and brought some conclusions that is fish is a good diet to control hypertension, yes or no. Some of the points I'm discussing with you here that the population studies showed that generally fish diet helps to decrease the cardiovascular diseases, that also includes stroke as well. And what the stroke can result? It can be result to be the hemiplegia, that's means the paralysis of any specific part of the body. Why? Because it also certain can stop to provide the oxygen. It means that is stopping the oxygen supply and the nutrients to the brain as well, because the brain and heart are the vital organs of our body. If they they do not get the blood supply, they can die abruptly within 6 hours or after 6 hours. So 6 hours is the maximum period to get the nutrition and the proper blood supply. Now, next point is related to the sodium. So, and in another intervention, what's found that restricting salt seems to be more effective for lowering the blood pressure, but in only hypertensive patient and comparative to the normal persons who did not have hypertension. So, how much it is correct? So, go further the researchers and find out what they got in their conclusion. And in this research, the researcher found that 2 grams per day is quite enough. Yeah. And from which sources the salt is coming in our diet? In cooking, table salt, and from food industry as well. But how? We will discuss it. Sodium in the form of the foods in the diet, especially the processed food. Why we say that it's not a good food, not good meal, because it contains 75% of the salt in the our processed foods. Then the table salt, it contains 40% of the sodium. Then other is the taste enhancer, that is the monosodium glutamate. It is also bad for our health. So avoid to use them, but it's still some caterings and in canned and frozen foods, still monosodium is there. The next is the baking powder. It is also not good for our health. It is also present and used to make the breads and the cakes. Baking soda as well. So what happened and what we can do, because without the sodium, food will be tasteless. We can put some herbs, some spices to manage it, some flavorings, some salt substitutes, so that we can enjoy the food with low sodium diet. And it, yes, of course, it should be under the medical and the dietitian supervision. So now next is the study that was done related to the alcohol. And what that researcher found, that excessive intake of alcohol can increase the risk of hypertension. How? It can increase the high arterial pressure of that person. So increasing the chances of getting high blood pressure. And in another research, it also found that there is found the increased prevalence of the people who use lot of alcohol in their daily life, and they are got with also hypertension as well. Here is the picture. It is showing how this plaque, this cholesterol fat deposits in our blood vessel. It's not a sudden process. It's gradually occur. The deposition of the fat in the form of the some streaks, so a little bit disruption in the endothelium of the, it's mean the inner layer of the blood vessel occurs. Okay. Then the stuff of the flat globule and then deposition of flat globules occurs. When this blood globules deposition occurs, the initial deposition is called as the atheroma. Then it further increased more towards the lumen, then it is called as a fibrous plaque. Then it increases more, almost covering half or more than half of the lumen of a vessel. Then it is called as a complicated lesion, complicated plaque that is risk for to get be ruptured and can be clogged and stop any other narrow small blood vessel, which is called as the embolus. This is the cross-sectional picture. It is showing more detailed vision. See, this is the tear of the artery where the plaque, where the fat started to deposit. Then there is a continuous vicious circle going on by the deposition of the fat around the endothelium, that is the inner wall of the artery or the human blood vessel. And in this way, it is narrowing the blood flow more and more day by day rather than the normal one. Can you see? It is very, very obvious in this picture. And it may sometimes can also called as a blood fog. It means that stopping of the blood flow, blood is stopped and it is clotted, it is frozen, so no more blood supply to that specific organ where this blood vessel is supplying the blood. So what happens in this result is that no oxygen supply, no nutrition. So that part of the organ, like the heart muscles, what happened? At that part, the person will start to feel the pain, like the angina pectoris. Then, if it not treated or get more worse, it can be lead to the myocardial infarction. It means cardiac heart infarctions, that ischemia because of no oxygen to the heart. Why? Because no blood to the heart. That's why. Then it can also lead to the stroke, for example, especially the brain. So its heart is not able to pump the blood. So first, which organ that will affect it? That is the brain. And if blood do not get oxygen or blood, so abruptly person may get caused to the die by the MI or to the hemiparalysis. Here is another picture showing you clarifying your concept in a 3D format. See, these are very narrow small vessels. If they get stopped by an embolus or atheroma or by the atherosclerosis, so that part of the heart is also affected, the function of that part of the heart. If it becomes worse or extended, then whole heart can be involved. So what are the manifestations of cardiac heart diseases? That it can lead to the MI, that is the heart attack, death of the heart because of no supply to the heart, and can lead to the death of the tissue and to the person as well. So what are actually the symptoms of the angina and MIR? Angina is because the sudden abruptly obstruction of the blood supply to the heart. So in result, the person can feel the tightness, burning, and the pain on the left side of the heart, particularly the jaw, left side of the jaw and the left arm of the person, and the person also feels the breathlessness. While heart attack is the more aggressive form that leads from the angina towards the heart attack or the myocardial infarction, in which the person feels intense pain in the chest, throat, and that tilts the whole arm, and weakness, breathless, indigestion, and fear of anxiety and impending doom. So, what are the nutrition interventions? In another research found that by using the olive oil and omega-6 and omega-3, that are the good fatty acids, are healthy for the diet and decrease the chances of the atherosclerosis. Why? Because olive oil contains the oleic acid, which is a chemical name of a good fat. It is also actually a mono unsaturated fat. That's why it's healthy. Then while omega-6 linoleic acid, it is also good. It is available in nuts, grains, corn oil, soybean oil, sunflower oil as well. While omega-3, the good rich source is obviously we all know nuts, seeds, and soybeans as well. Now the last one is the French paradox. What is this French paradox is? So please have a look on this video and discuss on it. So thank you. This is the reading list of today's session. Any comments, anything, more welcome. Any questions you want to ask? So goodbye for today. Hope you wish you good luck. Bye bye.